Hello, I'm Mary Ann. Welcome back to Live Life Well. Today we're going to look in on a discussion about anxiety disorder. I'm outside a hospital social worker's office and a patient's about to enter. The patient has just visited the emergency room during an anxiety attack. Now the patient's meeting with the social worker to talk about follow-up care.
Good afternoon, Maddie. Hi, I'm Zena. Have a seat. The ER doctor told me about your anxiety attack. However, I would like to hear from you. In your words, what happened?
Okay. I started to feel anxious for the past few days. It got to the point where all I was thinking about is what could go wrong. I started to feel like I couldn't breathe and felt like I was going to die if I didn't come to the ER. My chest was hurting so bad at the time, I actually thought I was having a heart attack.
Has that ever happened to you before?
Yeah, it's been happening for over a year, but it was never this bad before.
Did anything in particular happen to you think that made it different?
It just seemed to come out of the blue. I've had more stress lately with being in college and all, but nothing happened that day.
Have you ever seen anyone in the past about this?
No. I knew I probably should have, but I didn't know how it would sound to my family and friends. Many people deal with anxious feelings every day. I should be able to deal with it too, right?
You don't need to be ashamed for seeking help. There are many people who seek out professional help when it comes to anxiety disorders. Are you aware of the different types of anxiety disorders?
No, I didn't think there was more than just one.
Anxiety disorders can consist of generalized anxiety, panic disorder, and social disorders, and more. In fact, more than 3 million people struggle with anxiety disorders every year, so you are not alone.
I had no idea it was that common. How do we know which kind I have?
That is a great question. What is known as a psychosocial assessment will help you understand more about what's happening and to help us to begin to design a treatment plan together to help you.
So there is a treatment. What happens in this whatever you called it thing?
Psychosocial assessment is a fancy way to say you'll be asked a lot of different questions to find out the factors that could have led to you having these issues and to begin to address those.
How do I get one of those, and what can I do to treat my anxiety disorder?
To get a good assessment, you will schedule an appointment with an outpatient therapist who will meet with you and help you to identify what is happening. As for treatment, anxiety disorders can be treated through therapy or medication. For now, I can help you talk to your family and friends on what you have been experiencing lately so you can have a good support system.
I would really appreciate that because I don't know where to start or how to explain it. I feel guilty for not being able to do this on my own. I mean, I am in college and all.
No matter your age or education, anxiety can be difficult. Many people blame themselves for not being able to address it on their own. But remember, that is what therapists are for. They're there to help you to learn to address this for yourself. Did you know how to drive a car before someone taught you?
No, I get it. If no one has taught me how to deal with this anxiety disorder, then how can I know how to do it?
Exactly. So let's make a call to your family, and I want you to know that you're not alone. There are always people available to help you to live life well.
Well, this situation looks like it's in good hands. As always, Cahaba Valley Elks Lodge, in partnership with Central Alabama Wellness, is providing you this information to help you to live life well.